I am Dr. Minhaj Nasirabadi. I am consultant psychiatrist at Hyderabad. I am also honorary secretary, Indian Psychiatric Society, Telangana State Branch. I am professor and head Department of Psychiatry at Deccan Medical College, Hyderabad. Uh, I have a practice at part of city where I see lots of patients. Uh, I'll tell you briefly, tell you shortly a story about my practice. 15 years back, I started my practice at two places, one at very posh clinic and one in a poor locality. And the place where I started my practice in the poor locality, people said that, Doctor Saab, you won't get psychiatric patients over here. You'll get psychiatric patients only in posh locality. Don't waste your time over here and you won't develop your outpatient practice. But over a period of time, what I have found out that in my posh locality, I see 5% of my patients, that is around 5 to 10 patients, while in my poor locality practice, I see 60, 70, good number of patients. And to be very frank with you, uh, nobody can call them psychiatric patients as such because they don't appear to be what typically a psychiatric or mentally ill patients would look like. But they are more of having some pain complaints. They have some somatic symptoms or pain symptoms. Most of my patients have some pain. They come with pain to me. Many of them have headaches, backache, body aches, multiple body complaints, somatic complaints, what we call. So, how come a psychiatrist treating somatic symptoms or pain symptoms? Most of them have been worked up by physicians, neurologists, cardiologists, and then they are referred to me, a psychiatrist, because the cause of their pain is not found out, or they feel that this the pain is the feeling, the emotions attached to the pain are far more than what the pain itself is. So here comes my role, and most of my patients I see are having somatic symptoms or they have what we call according to DSM-5 as somatic symptom disorder. So what is it? Somatic symptom disorder is characterized by extreme focus on physical symptoms such as pain or fatigue that causes major emotional distress and problems functioning. The patient may or may not have another diagnosed medical condition associated with these symptoms, but his reaction to symptoms is not normal. If the patient has somatic symptom disorder, he may experience significant emotional and physical distress. Treatment can help ease symptoms, help him cope, and improve his quality of life. So, what all symptoms these people have? They may have specific sensations such as pain or shortness of breath, or more general symptoms such as fatigue or weakness, unrelated to any medical cause that can be identified or related to medical conditions such as cancer or heart disease, but more significant than what is usually expected. A single symptom, multiple symptoms, or varying symptoms. The symptoms can be mild, moderate, or severe. Pain is the most common symptoms. Whatever are his symptoms, he has excessive thoughts, feeling, or behavior related to these symptoms, which causes significant problems, make it difficult to function, or sometimes it is disabling. What are the causes of these somatic symptom disorder? Researchers have they aren't sure that what it is the actual cause, but it seems that some people have genetic traits such as more pain sensitivity, have negative affectivity, a personality trait that involves negative emotions and negative self-image, difficulty dealing with stress, decreased emotional awareness, which can make them focus more on pain issues than emotional issues, learned behavior such as getting attention from having an illness, or increased immobility from pain behavior. Any of these traits or combination of them can contribute to somatic symptom disorder. In our context, more so or in Asian context or Indian context, we are not trained to tell our emotion. We are not trained to talk about our emotions, such as sadness of mood. If a child or a person comes and tells his parents that, "Mommy, today I'm not feeling well and I don't want to go to work or I don't want to go to school." Mother will say, "No, everything is fine. You are looking fine. Why are you sad? Why are you depressed? No, go to the school or go to the work." If the same child comes and tells mother, "I have headache," the mother will take care of him. Better take rest. Don't go out. Do you want some medication for that? So, in a way, we are not trained to express our emotions, but we are trained to express our pains or somatic symptoms. So that is, the somatic symptoms are given importance, and thus we tend to develop, uh, we tend to express more of our emotions in somatic ways. So many a times we don't express our emotions, we don't say that we are sad, but instead we say that we have headache or back pain. So our focus is more on physical symptoms rather than pain symptoms. So that is a cause of more somatic symptoms in our Asian population or Indian population for that matter. What are the risk factors involved in somatic symptom disorder? If a person has anxiety disorder or depression, or if he has a medical condition or he is recovering from one, or he is at risk of developing a medical condition such as, if he has a strong family history, or he is expressing a stressful life events, trauma or violence, or he has experienced past trauma, childhood sexual abuse. We have also found out, researchers have also found out that having lower level of education and low socioeconomic status can also is also a risk factor for somatic symptom disorder. What happens if even if you have pain or you keep on thinking about your somatic symptoms, uh, burning sensation or pain sensation or shortness of breath? So what? That can lead to different complications. Somatic symptom disorder are associated with poor health, problems functioning in daily life, including physical disability, problems with the relationship, problems at work or employment, other mental health disorders such as anxiety, depression, personality disorder coming out of it, increased risk of suicide related to depression, financial problems due to excessive healthcare visit. These people, they tend to visit multiple doctors, going to one doctor from another doctor and asking whether they have some illness or why their pain is not subsiding or why their somatic symptoms is not subsiding. Do we have a diagnostic criteria or criteria for diagnosis? Yes, according to DSM-5, we have a diagnostic criteria. The patient must have one or more somatic symptoms, for example, pain or fatigue, that are distressing or cause problem in his life. The patient has have excessive or persistent thought about seriousness of his symptoms, and the patient continues to have symptoms that concern him typically for more than 6 months. So he should have pain or fatigue symptoms and excessive thinking about that symptoms at least for 6 months. Then you can diagnose him as somatic symptom disorder. So where is the treatment? How do we treat them? Because it is not the pain, but it is excessive concern about the pain. So the goal of treatment is to improve symptoms and ability to function in daily life. Psychotherapy, which is also known as talk therapy, is helpful for somatic symptom disorder. Sometimes medication may be added if the person has anxiety disorder or depression along with somatic symptoms. Many a times physical symptoms can be related to psychological distress. So in these cases, psychotherapy, especially cognitive behavior therapy, is helpful in improving physical symptoms. Many a times, because of the impaired family relationships, there are somatic symptoms, or they take illness role. So family improving family relationships and functioning family support does help in these cases. In some cases, antidepressant medication can reduce symptoms associated with depression and also pain that occurs along with somatic symptom disorders. So these are the professional helps which are available. Many patients do get benefited by learning stress management. Some patients do get benefited by doing progressive muscle relaxation exercises, and thus they improve symptoms. So this was about somatic symptom disorder, which is very common in our country. Most of the patients with somatic symptom disorder uh, will come to a physician. They will visit pharmacies. Many will visit cardiologists or other specialists, but many of them they don't turn up to psychiatrist because they don't know that it is a kind of psychiatric problem or psychiatric illness. We know that around 30% of population suffers from depression, one type or other type of depression. Many a times this depression is masked. What is masked depression? Masked depression is the person has depressive symptoms, but he is not trained to express his emotions. He is not trained to say that he has sadness of mood. So how does he express? He expresses himself by having by telling his pains. He has excessive concerns about his pain or burning sensations or extreme fatigue, and he has somatic symptom disorder. So most of our patients or depressed patients will have some somatic symptoms, and they'll keep on suffering, which will lead to many complications, as I told, financial difficulties, problems in relationships, and other problems, occupational dysfunctions, and other problems. So I think that patients of somatic symptom disorder or patients coming with unexplained pain or excessive worrying about pain should be screened for depression and anxiety, and they should be treated by psychiatrists. Thank you.